Okay, good.
That was too short. Okay. All right, we got some reading to do. So is the 87-year-old female. She had asymptomatic wet AMD in the right eye. It became symptomatic and she started the Lucentis, the ranibizumab. In 2022, she was getting Q2 month injections. She had 20/32 vision. Her most injection in the right eye was 2 weeks ago, which at the time she did not have the follow, she didn't have an examination.
It's a treatment. We all, most of us do
quickie.
treatment only visits. Do you guys do those at USF?
Yes, we do. We call them
Okay.
quickies.
A quickie, okay.
We do not call them that.
And you hear that?
Or fast track, or fast track, fast track. Sorry, fast track idea. Who calls them? Someone calls
Fast track.
Someone calls them quickies at the VA.
I'm sorry.
I didn't make it up. All right.
Uh,
She came in for a fast track. So she did not have an exam. The most recent dilated exam was 3 months ago and no mass was noted. She had lid swelling and saw her ophthalmologist who saw a choroidal mass and had her come back for a visit. The date of that visit and these images is 9/7/22. She did have breast cancers in 1989 with a recurrence in 2009. And she had 5 years of tamoxifen and mastectomies. Other medical history, thyroid disease, diabetes, arthritis. She just got her flu shot, and then colitis and what, clitoridynia?
I don't know, it's in the chart. Keep going. I feel like
Oh my gosh.
it's like middle school.
Oh my gosh. So surgical.
Alex, have you read this before?
I didn't read that. Sorry. Surgical history: mastectomy, C-section, gallbladder, thyroidectomy, appendectomy, knee replacement, right hand surgery, cholecystectomy, hysterectomy, tonsillectomy, Mohs a week ago near the nose and the left eye, and she has stitches to be removed next week.
When was that?
No, that was back in 2021.
Yeah.
All right, so you can go ahead. This is just history.
Okay.
So the vision was good.
And medical marijuana.
Yeah.
All right.
87-year-old.
Man.
I respect it.
Okay, the vision, 20/32, both eyes, IOP 14 and 16. Woo. All right. Stan, what do you see?
All right, so color fundus photo of the right eye. The media is clear. The optic disc is unremarkable. The vessels are also unremarkable. The macula seems to have some lightish pigmentation. It looks like some sort of atrophy of the RPE at the macula. Very classic.
Shots for AMD.
For wet AMD, yeah, very classic AMD. And your attention is drawn to the temporal elevation of the retina. It also looks like the vessels are coming towards you, so it also looks like it's a retinal detachment.
Okay. We got some other images. He described these ones for us.
Yes, so a B scan was performed, and it looks like there's fluid underneath since it's a little bit hyperechoic. Also, there seems to be maybe some separation of the choroid from the sclera. I'm not really sure. But so it looks like a serous retinal detachment.
You go back to the other pictures, the color picture. Yeah, what color is that?
That, I'm not sure.
It made some color.
It looks,
It looks like gray orange to me, and
Grayish,
this almost
yeah.
looks like a vessel.
it doesn't look a little brownish or gray.
A little bit brown, yeah, it could be.
Yeah, I mean, retinal detachments are corrugated. It looked a little brownish for a
Yeah.
retinal.
Yeah.
But
Retinal detachments are white from edema, and it's the only reason you see them.
Yeah.
Because
yeah,
you
because the
rarely
retina is
use
transparent.
actually binocular.
So I would just say it's an elevation. I wouldn't go right to retinal detachment. There's something elevated there.
Is that your depression?
Yeah, if I saw this, I'd say there's probably like
Yeah.
RPE under this, whatever this is.
I think, yeah, that's what I think. I think it's the RP came off with it.
Yeah.
I think it's, okay, go ahead.
Do you have a video of the
Soft there.
No. I don't know if I can with that machine.
And to
I
me,
can with that machine.
But did you look at?
If it shifted?
I'm interested in something there.
Yeah, this is in, no, that's why this is, yeah, Paven, Dr. Paven got all of this. Yeah, I didn't video it, but yeah, sorry, go ahead.
and then this, to me, it doesn't have the same echogenicity of the vitreous, so maybe it's kind of like it's not heterogeneous, but it doesn't look like it's just fluid to me. It looks like there's something in the fluid.
Yeah, the reflectivity. So would that be low, medium, or high? I'd call that.
I'd say it's medium.
Yeah, I think medium, yeah.
Yeah.
Dr.
But-
Paven.
but I mean, I don't know why, but it does something.
Okay, go ahead. No, I'd love to hear what you say.
And then we got some measurements here. C1, so it's 8.1 millimeters and then 18.2 millimeters. So quite large. Oh, we have the OCT. Oh, sorry, Sam.
All
We
right,
got
so
the-
OCT of looks like some age-related macular degeneration. You can tell by the drusen at the RPE. The RPE's contours also looks varied. And I cannot appreciate the temporally, but possible also an ERM temporally.
It's interesting. I didn't notice this before, but the choroid's pretty thin, but the sclera is pretty thick. You can see
Yeah.
it's interesting.
I didn't pay attention to this bit either, but this looks.
Yeah, it's a very thin.
You got a lot, you got a posterior ciliary coming in there.
Yeah, coming right at you.
Oh. Sam, you have a differential for this
Oh
thing?
man, I missed it. I was gonna say I agree with you. So
So what-
I would say probably PED, RD, Mets maybe from her previous cancers, and AMD. I missed your other ones.
Yeah. Oh, yeah, something along the lines of some kind of an effusion or a mass, choroidal effusion. This entity called peripheral exudative hemorrhagic chorioretinopathy, is it PEHCR?
Pecker.
PECR?
But wait, what, okay, wait, stop.
Too much.
Wait, was she in her extended med list that you provided to us? Was she on anticoagulation? Because have you ever seen a case of PECR where they were not anticoagulated? Or had some
I think so.
hematologic issue?
Well, they're all old.
Yeah, but like, I feel like all the ones that I've read
I'll look
about,
for
they were
that.
either super therapeutic on Coumadin, or they had some underlying malignancy that made them prone to bleeding.
That looked like blood to
I've
me.
not connected that, but
To
I'll
me, it
look.
looked like blood.
Well, I have a different theory.
Yeah, I want to hear that. We gotta keep
So
going.
metastatic tumor, primary ocular tumor, retinal detachment. Even though it doesn't really look like a retinal attachment, looked like there was like RPE under it. Capillary hemangioma, a macroaneurysm, that would be just like the biggest macroaneurysm
No, it
Ever?
would be a hemorrhage from a macroaneurysm into the choroid.
there. That makes more sense. And then fever,
Okay.
so.
Good.
What's your theory, Dr. Paven?
Well, if you
I
go
sent
back-
him the case. He's seen
No,
it.
I haven't looked at it.
Oh, you didn't look at it?
I'm very lazy. I'm having
I
trouble.
was like, this is like my worrisome.
This is great, we get the real time.
No, I'm having trouble with my taxes. I can't decide how much jail time I want to go back.
All right.
So, that picture, for some reason, makes me think of those are RBCs. And that's why I wanted to see a video, because they may be circulating.
Mm.
Oh,
So,
I didn't notice that, but that.
well,
Okay.
you see what you expect,
Right.
what you're looking for.
Yeah.
But, it's to me, it's neither a melanoma nor a met. It's mets, it doesn't look at all like a met. They are depigmented primarily. It could be an early met in its picture, but eventually they change and get the leopard spots. And the history is classic. It's she had a manipulation.
Mhm.
And I think that caused a peripheral hemorrhage. And it was in the choroid that, now you say you don't see this, you don't see PECR, I call it the ectopic.
Ectopic,
Yeah, that's what I call it, but. So. One of my classmates, Ned Cabot, medical school. Was swept over. From his yacht. When he was sailing towards Greenland out of Nova Scotia in a gale, and he died. He was, Cabot's and Lodges of Massachusetts. He was the scion of that family and his generation. So he was, a Boston Brahmin, but the point is, it was a rogue wave that got him. He came up out of the cockpit, you always clip on. And he hadn't clipped on yet, just a split second, and he got swept over. And so did the helmsman, and they recovered the helmsman, but because their steering mechanism was damaged by the rogue wave, which, basically turned the boat on its side, he wasn't recovered. So I talked to my son about it. And he said, yeah, rogue waves. He said, they used to think they were rare because, ships rarely encountered them. He said, but now that we have satellites, he says, they're actually very common. But they go a short distance and then they disappear, relative to ocean turbulence. So this is, I think, a rogue wave. I think they're more common than you think. If you look in periphery of old people, you will see, and the older they are, the more you'll see, all these pigmentary changes in the periphery, right?
Right.
They usually
It's
get through
from
temporal.
this, if they had an event and they've absorbed it.
Hmm.
And so I think it's much more common in old people than we realize. And I used to go to the Jewish hospital in Boston. I forget what the name of it is. It's off of the Back Bay. And I'd see these people who had a cataract surgery and then now were unable to take care of themselves, but they were fairly with it. And they had horrendous pigmentary changes all over their retina. And I couldn't understand it. And they never sent an attending with us, so I couldn't ask anybody.
Yep.
But years later, I thought about it.
Yeah.
I thought about it and I said, yeah, that's probably what I was looking at. Just the, you get old, you degenerate. I'm an example, but I think it's a rogue wave phenomenon.
And she just hasn't developed the pigmentary changes that you would
Well,
expect.
she may not, she may not, because this is not a big bleed. This is mostly fluid.
Okay.
So, did the needle, did they not go in far enough?
That's
They
what I was
check-
wondering. The injection was 2 weeks previous.
Yeah, but if it were pure fluid,
Yeah.
it would resorb.
Right.
I have,
And I usually
I
inject
used to
it,
detach the
You do
retina
inferior-
when
I
I
was
used
gonna
to
ask,
do the macular migration.
Yeah, the macular translocation.
Translocation, and a couple of times I injected the choroid. You know how long the choroidal effusion lasted?
Right.
3 seconds. You put fluid in the choroid, it's gone. It's
Right.
just
That
amazing.
makes sense.
So, well, it was unusual for me because choroidals like this take weeks
Right.
after surgery to go away. So I don't know, but I think it's a much more common phenomenon. And you see the residual in your older VA patients, I'm sure.
Judge Cohen, do you have your email up on this computer?
Yeah.
Can I send you something?
Sure.
Why do the choroidals take these shapes? I was reading there's some anatomical structure
I
that
don't
makes them
know what that
divide.
is long.
I think this is another,
It-
I think it's
I'm not
another
sure.
one.
It could be, but they might say, it. I never know.
Was it the
But it-
the arteries that do
maybe
it?
where the vein goes.
Oh, the vortex.
It's the veins, yeah. I was reading it yesterday in one of the
The
questions.
vortex.
Yeah,
veins.
it's the vein, and that's why it separates
I never
into
thought about it.
discrete.
All right, let's keep going. We got some more cases. Thank you.
Did it go away?
Yeah, what happened?
Keep going. So this is sick. I sent her I thought it might be a Met, so sorry about that. So 6 weeks later, she came in. Keep going.
The mass had vanished, so 6 weeks.
You gotta show the picture.
So you fixed her with the
Yeah,
scan.
good job.
Yeah, the PET scan.
little radioactive sugar.
Important point here. You need to operate right away.
You can-
People get their better.
That's right, that's right.
Straight while the iron's hot.
And we got an ultrasound.
And what's the other dictum you have, that the patient will do everything to go against your treatment, or
No, that's not
you
me.
gotta treat them before they get better on their own?
Yeah, that's my dictum. For certain diseases.
Yeah, you should have lasered that thing, it would just vanish.
Put a plaque on.
6 week follow-up.
So yeah, so these are the scans in the same place. So you think it's a choroidal hemorrhage? I thought choroidal hemorrhage probably from a
Yeah.
Pecker.
Yeah,
So go ahead.
But
So
it didn't have to be. I think they occur.
it might have been the shot.
It almost, I don't know if I'm just seeing.
No,
this.
I think you're, I think that is.
I think
Yeah,
a little
there's
something,
there's a
right?
demarcation line.
It's a little something, and
Yeah.
there even might be a little still there.
That's,
that's
no,
vitreous.
that's vitreous.
That's just vitreous.
That's true.
And then
just
there's the
macular
OCT.
thing.
So PECR, peripheral exudative hemorrhagic chorioretinopathy.
They could have been famous if I thought of that.
Mark loved that abbreviation. You're old. Is he still around, Hankins?
Yeah.
Could never stop talking about Pecker. I don't think he was talking about the eye though.
Yeah. Yeah. Oh my gosh.
Go ahead.
That's the best one.
Yeah.
Oh my gosh. Yeah, you wouldn't want anyone's name associated with this. Because it would be someone's pecker. Anyways, uncommon degenerative process with subretinal or sub-RPE hemorrhage and exudative mass outside of the macula. It can mimic a choroidal uveal melanoma, so a pseudomelanoma. The awareness is important because the management is very different from a mass, which is observation. The knowledge we have on these is based on case series. As per usual, Dr. Shields has the largest case series. And then there was a couple others. Mantle had 40, Ainsley had 27. I think those were one of the original case series, and there were some even smaller ones, like 8 or 4 people. Vision loss you can have as a symptom. The mean size is pretty big, 10 millimeters. 75% are in the temporal quadrant. They say it's an inferior temporal quadrant between the equator and the oral serrata. So maybe it was related to the injection. Maybe that's just where these things go.
It can be anywhere.
And then risk factors, these are based on the case series, the age range 77 to 83. So
Gotta be
older.
77. And then I will have 4 of those risk factors.
Hypertension, half of them had it on some kind of anticoagulation, like Jacob was saying. ARMD, one of the case series, and it didn't say which. So it could have been one of these smaller ones. It said like up to 70%. Which almost made me wonder, like, because I was thinking maybe this could be related to the injection, and maybe the ARMD has something to do with this in some form.
Yeah, I think
There's between AMD and peripheral bleeds.
Yeah.
And I guess you could know that because some of these case series are before any of these injectables came out.
Yeah.
And they were still,
Gray, 6F, code gray, 6 Foxtrot.
and then RPE changes, and then macular choroidal neovascularization.
Clitoridynia is not a risk factor.
Not that we know of.
Keep going. We have some other things.
So I thought this was a really great picture. You can see blockage from the blood. And then these are the changes left behind afterwards, after it
You
was.
see that all the time.
So I thought this was a really good picture they had of it. And then here's one kind of, similar. Your pecker was bigger. But
He's not gonna deny.
it looked quite similar. All right,